2002, Ghana has benefited from a cumulative $800 million from the Global Health Fund to fight HIV, malaria and tuberculosis. This has led to some strides, with about 60% of persons living with HIV receiving antiretroviral treatment. Mortality due to malaria also dropped from 0.32% in 2016 to 0.1% in 2019, while testing and treatment of tuberculosis is free in all public health facilities. Again, about 85% of new TB cases were successfully treated. The new funding Module 3 grant of $238 million, which spans 2021 to 2024, will include new components to strengthen healthcare systems to improve health outcomes.
We are rolling HIV self-testing through community pharmacy systems to improve testing amongst the people. We are also introducing pre-exposure prophylaxis for key populations, TB preventive therapy among people living with HIV, and scaling up differentiated service delivery initiatives. This is to ensure continuity of services in the midst of the COVID-19 pandemic.
Mr. Ajiman Menu also said the Global Fund is assisting the country to procure more vaccines to further reduce Ghana's active cases, which currently stands at 2,000. The WHO representative and interim chair of the country coordinating mechanism of the UN systems, Dr. Francis Kasolo, entreated government to be accountable for the grants in order to attain a resilient health system. While commending Ghana for its strides in HIV, malaria, TB, and now COVID-19, the head of grants management at the Global Fund, Mr. Mark Eddington, said for Ghana to attract additional grants from the fund, it must release the counterpart funding on time to effectively implement its scheduled programs. The U.S. Ambassador, Ms. Stephanie Sullivan, said the introduction of the new treatment regimen for HIV has significantly improved the life expectancy of patients. President Akufo-Addo applauded the Global Fund for its support over the years in improving healthcare and systems in the country. He assured the donors of increasing domestic financing to reduce morbidity and mortality as a result of HIV, malaria, and TB.
This grant will help Ghana through the Global Fund's investment in our health sector. We now have the capacity to screen some 900,000 persons for HIV and offer them preventive services. The fund has also supported the retooling for TB diagnosis, with 128 gene expert serving as the means for first-line testing. The introduction of this diagnostic test has improved TB diagnosis, with the gene expert machines also being used to test for hepatitis and cervical cancer. Despite these notable achievements, the morbidity and mortality associated with these three diseases continue to pose threats to our development.
President Akufo-Addo further called for accelerated efforts should Ghana eliminate HIV, malaria and TB by 2030 as stipulated in the Sustainable Development Goals. With this third tranche of funding, a facility to treat drug-resistant TB patients will be constructed at Nsawam. Sarah Fori, GBC News, Accra.